Truven Health Analytics has been addressing the clinical decision support needs of providers for more than 30 years. Many of our clients will probably know us better as Micromatic Solutions, which is the brand name under which we sell our evidence-based clinical content solutions like drug decks and poison decks. Healthcare professionals in more than 80 countries globally rely on our clinical decision support tools and evidence-based drug, disease and toxicology information. We also provide patient engagement tools in more than 15 languages. These years, hospitals globally are placing tremendous focus on improving quality, and that within the constraint of tight budgets. They simply need to do more with the same funds or even with less funds. Our provider solutions focus leveraging patient and hospital data to help hospitals in three key areas. Our 360 Care Insights provides tools and resources to conduct real-time clinical data surveillance to better manage patient risk and improve patient outcomes. Care Discovery look to leverage hospital clinical data and combine that with intelligent analytics to benchmark and identify opportunities for improving patient outcomes. And finally, our Action OI suite defines help hospitals define strategic direction and aligns resources to drive cost savings and operational excellence. This is all done through benchmarking against other similar hospitals.
In pursuit of operational performance improvement, the goal is always to establish optimal processes and improve the quality of patient care and promote the efficient use of resources. Now, to accomplish this, facilities have to report or have to look at the good, the bad, the ugly performance, and it must be identified and actions taken by multidisciplinary teams that include doctors and nurses and department heads and ancillary managers and staff. Now, awareness of performance and quality initiatives is the responsibility of everyone in the healthcare environment. It's from the board of directors to the C-suite, right going down to the staff. Now, that being said, providers need to take care of two critical factors. The first one is reporting consistency, and it is important to have a framework in place that supports reporting consistency. Truven Health Analytics, with our solution, we help our customers create consensus on how they define statistics, how they define different clinical, operational and financial parameters. For example, when they subscribe to our Action OI product, which Bear spoke about, which is our operational and financial performance measurement and benchmarking tool, they subscribe to our methodologies and we help them establish the framework to enforce the changes that they wish to make. The second critical factor is communication. They need to form the objectives of performance improvement and the objectives need to be communicated, dissipated across throughout the organization. What are we doing? Why are we doing it? That's important to communicate to the right from the executives to the staff. And the progress you're making against those objectives, it's equally important to keep your staff updated with that. We really set ourselves apart with our methodologies that come bundled with our tools and resources that providers use to define, track, measure, and benchmark clinical, operational, and financial outcomes. Another very strong differentiator for us is our ability to take our customers' data and normalize it against the biggest and the most robust clinical, operational, and financial benchmarking databases. For example, our clinical benchmarks are based on one of the largest available inpatient administrative databases that comprises of discharge data for 23 million patients. That's huge, and that represents 2,700 hospitals each year. Our operational and financial benchmarks are based on actual and normalized data from 750 participating hospitals and healthcare organizations and 250 departments within the hospital. Many, and I can broadly categorize them as clinical improvement results and operational and financial. So let's talk about the clinical performance improvement results. If you look at our client Kettering, this is a multi-speciality health network with 8 acute care hospitals in the state of Ohio in the US. It's among the top 100 hospitals in the world. Now Kettering uses Truven Health Analytics Solutions, and they have reduced the length of stay by 50%. They have reduced readmissions by 17%, and they have achieved an annualized cost saving of $800,000, more than $800,000. Let's take another example, Roper St. Francis, which is in South Carolina. Now, Roper had an interesting situation where they had a lot of patients coming in for surgery with fragility fractures at the time of admission, and they succeeded in reducing mortality by 50% in this patient population. In terms of operational efficiencies and cost savings, we have clients like Wellstar. This is a community-based integrated healthcare network with 5 hospitals, 1,300 plus beds, 11,000 employees, and they service the Atlanta region. Now, Wellstar again used our ActionOI product, and they were able to identify $90 million in annualized financial improvements, and $15 million of that was in labor expense savings. That's huge. These are amazing results that our clients have achieved. If I was to talk more specifically about Asia Pacific, here the clients use our evidence-based clinical content for improving the quality of care, providing excellent decision support for the pharmacists and doctors at the point of care. They're even using our solutions for JCI accreditation. I mean, if you use our products, you're meeting 5 out of the 6 as patient safety goals as mandated by JCI. A more recent use of our solutions, especially on the analytics side, the surveillance side, has been in monitoring and tracking of pandemic outbreaks in the community. And if you use a real-time surveillance tool in the emergency room, for example, you can actually 24/7 monitor patients who are coming in and pose, or show symptoms of a pandemic breakout. So there are different ways that clients are using our solutions and deriving benefits out of it.
Well, I think it's fair to say that from a global perspective, a lot of hospitals are facing very similar issues. However, in response to specific customer needs in certain international markets, these years we are growing our customer analytics and consulting services capabilities in order to help customers address challenges that are unique to their regions. We combine software and methodologies with intellectual and human assets to help our customers tackle issues that they cannot alone solve. We have also been working with some of our clients to build country or region-specific clinical and financial databases in order for them to compare themselves to the best performing hospitals on a local, regional, or even a global level. Truven is still very much committed to continue to invest in key international markets like Asia Pacific. Right now we have been staffing up our Asia Pac headquarters based here in Singapore. We have grown our direct headcounts in Singapore and Australia. We are continuing to grow our distributor and value-added reseller systems throughout the region. And we have partnerships, formal and informal, with EMR vendors as well as system integrators, many of whom are exhibiting at this very event.
In terms of Asia Pacific, I would like to add to Pear that we have almost 500 clients in the region, and this is across 15 countries where we have clients. Some of the leading public and private sector hospitals in the region are using our solutions for well over 20 years. So this shows that our clients trust us. They have confidence in our ability to deliver good quality products and solutions to the healthcare sector. Now we completely intend to build on that confidence and the trust, and hopefully lead the way in assisting our clients with, that are willing to make a commitment to make analytics and performance benchmarking core to their future strategies.